Greetings. Today I'm going to be talking about my showcase for the talk entitled Deep Learning-Based Automated Left Atrial Flow Quantification of Real-Time Phase Contrast MRI in Patients with Atrial Fibrillation. Atrial fibrillation, or AF, is the most common sustained cardiac arrhythmia, where normal cardiac rhythm is disrupted, leading to slow flow hemodynamics that may lead to clot formation and possible stroke. Cardiac MRI has the potential to measure atrial flow biomarkers, which may aid in treating these patients. 2D real-time phase contrast may best capture such flow dynamics, where here I'm showing the oblique plane parallel to the mitral valve, which is what we utilized in our project. This is due to high temporal resolution, enabling it to capture variational beat-to-beat flow information, which may better characterize arrhythmia. However, this technique requires segmentation of the 2D left atrium, which is clinically infeasible for hundreds of frames per patient. So the purpose of this proposed project was to train an AI to perform the segmentation of the left atrium from 2D real-time phase contrast images automatically. Here is the cohort and acquisition methods used for this project, noting 34 patients and 39 total scans. Each scan was acquired for 5 to 20 seconds, yielding 60 to 360 frames of data per patient. Notably, it took 10 to 25 minutes to generate a segmentation via a manually driven processing tool for each patient. Manual segmentations were used as ground truth input for testing and training the model using 5-fold cross-validation at the patient level for the dense unit convolutional neural network shown here. Notably, we used 3D dice and logit for our loss functions. For testing evaluation, we used dice scores with a human observer, showing an example of the segmentation over time here at the bottom. Here are the best, median, and worst overall patients from one of our testing folds, where the 2D dice score, averaged over the total number of frames, is listed. For the entire 39 scans, we had an average 2D dice of 0.92 plus or minus 0.12 in testing. Inflow quantifications were then performed using manual and AI-derived masks. Peak velocities agreed well in both correlation and Bland-Altman analysis. Displayed is a patient with the median average 2D dice score among all patients, comparing the blood flow between manual and AI and demonstrating good agreement. I'd like to thank my collaborators and lab members as well as you for your time and listening to this short presentation. Thank you. If this teaser has intrigued you to know more about the project, please watch the longer 7-minute talk. If you have questions about the project, there will be a Q&A session for the talk during the conference. Thank you.